Now for the next issue as related to the joint, we'll talk about a special way to image the joint. So I'll use this way to actually access the joint and confirm if there's an issue, if there's a pathology, so that's what arthrography. We spoke about arthroscopy, where we said arthroscopy is surgery of the joint. So arthrography now is imaging, alright, and usually they add contrast. That's a material that will now enhance image of all those ligaments, all those tendons, So it's a diagnostic imaging technique, and it's used to evaluate joints. And they inject contrast medium, just like I was telling you guys, could be iodine-based or gadolinium into the joint space. So after they inject the contrast, that's when they now use either X-rays, CT scans, or MRI. Alright. So the purpose is just to assess joint integrity and dictate abnormalities of cartilage, ligament, tendons, and also capsules. So use it to now identify all those tears, degeneration, loose bodies inside the joint. Okay. So you now stage the condition and know the type of treatment that a patient needs. Okay. So you can use it for the shoulder, you can use it for the knee, you can use it for the hip, you can use it for the wrist. So that's just all we have. So technique, preparation, patient's consent, you have to tell them, explain to them a bit about what is happening, and also you give anesthesia to relieve the pain. So contrast medium will now be injected into the joint space, and it's usually guided. Something is guiding it so that I don't injure other structures, right? So imagings, we have the X-ray arthrography, we have the CT arthrography, we have the MR arthrography. Depends on what, either using X-ray, CT scans, or MR. So findings, we say that smooth joint capsules, intact cartilage, or no leaks, that's when it's normal. But abnormal, that's when you're now having all those tears, irregular surfaces, and loose bodies. So that's what we got for this, for the arthrography.